Well, hello, everybody, and welcome back to this installment of the 2014 Endurance Summit. My name is Manny Aragon. I'm the founder of the Rolf Workshop Center for Structural Performance, and we've got another great episode for you today. Today we have online a very special guest. He's a colleague, somebody I've known for a number of years, and absolutely trust in the integrity of his treatments and also of his wonderful center. His name is Dr. Joseph Zappala. He's a chiropractor, and he's going to tell us more about his sports medicine certification in a minute. But he's been a chiro for the last 24 years, and in general, he specializes really in the treatment of sports injuries. So unlike your typical chiro who might see somebody, athletes walking in the door, he's actually specially certified to treat sports injuries in all kinds of different situations, ranging from competition to in-office visits. He treats athletes from all sports, including gymnastics, dance, tennis, baseball, football, basketball, hockey, and endurance sports. As a former athlete, Dr. Zappala understands the functional correlation between what he does as a chiropractor and how an athlete performs at his or her sport. He performs his assessment and prescribes treatment based in relieving pain and restoring function to the injured area. This often leads to increased performance and decrease in the recurrence of injuries. He preaches active care to all of his patients, whether they are athletes or just aspiring to be, use it or lose it. So, Dr. Z, there's so much more here. I could probably go on for half an hour with all the cool things that you do, but tell us a little more about, officially you're a chiropractor, but your practice just has so much more. There's so much coolness to what you do. Tell us a little more about your center and how you got it started. Where did the idea come from?
Well, thank you, Manny, first of all, for having me on this evening. The idea was kind of hatched back in 1989. When I first got out of school, I joined a fairly large practice that had 10 chiropractors, and we also had an osteopath on site. So from my very, very early stages of practice, I was aware of a medical presence in our office. We had a diet and weight loss center in there, so we took a multidisciplinary approach when I was very young in practice, which is when I was 23 years old. So I learned quite young that integrative health care is what the patient wants. So as I worked my way up the ranks there and ventured out on my own in 1994, I sought to kind of recreate that sort of interdisciplinary medical care in my own setting, but to kind of tweak the practitioners, so to speak. So it's slowly evolved over time. My first office I had maybe 1,600 square feet, whereas today in 2014 we've got just about 7,000 square feet, and our team comprises of several sports medicine chiropractors like myself. We've got a wonderful acupuncturist there. We have a nutritionist on staff. We have a cryo sauna, which we can get into later. We have personal training there, sports-specific training. We do quite a number of things, massage therapy, sports therapy. So we utilize a team approach when we manage our patients.
Awesome. And there's so much more. I'm sure we're going to dig into that a little bit more during the conversation. But you've been doing this for quite a while now. What is it, like 25 years or something like that? How long has it been?
25, going on 26, yeah.
Oh, wow. So, and you've been serving athletes all along, but more recently, you've given yourself more of the sports medicine focus. I know we talked a little bit about that before the call, but if you can talk a little bit more about what drove you to go there, and then what that differentiation is between what you do now and, say, what you did as a general practice chiropractor.
Great question. I was an athlete my whole life. I grew up as a basketball player. I actually seriously considered and thought I was going to be a professional basketball player. I was recruited to go play in Spain right out of high school, so my thought was I was going to be in the NBA one day, and that was going to be my life. And when that didn't come to fruition, I realized I wanted to work with athletes and started practicing as a chiropractor. But in the beginning, when you start your practice, you can't really overly specialize. You kind of build your practice and pretty much take everybody who comes to you. And then as time goes by and you get more successful, you can kind of develop a specialty, which I had been doing. I got pushed about 5 or 6 years ago real hard when an ex-NFL football player who lives close by and is one of our patients came to me and suggested that I become the team physician for our local high school here in Costa Mesa High School. And I said, well, I really don't have the tools I need in my tool belt to accommodate you, but thank you it's very flattering, and I kind of turned him down. And then he kept asking and pretty much started to beg that I come help the team out because there just wasn't anybody there to help out with the injuries. So I just went in blind, started mid-season, and I was on the sidelines managing fracture dislocations and concussions and things that I was sort of seeing for the first time right in front of me in the office. You see the patient well after the trauma, so the diagnosis is pretty clear a lot of times. It's very very easy to diagnose someone once the injury has taken place, but when the injury is actually transpiring in front of you, it requires a whole different skill set. So once I got thrust into that situation, I realized that I was in over my head and sought out additional training to better myself. I realized I needed more bullets in the gun, so to speak. So in the field of chiropractic, there are multiple types of specialties. You can become a specialist in sports medicine, orthopedics, neurology, to name a few, radiology, and they're advanced degrees. They take 2 to 2.5 years. Some of them involve publishing research. So I pursued sports medicine. I actually pursued 2 of them concurrently. One is called what's called a CCSP, or a Certified Chiropractic Sports Physician. I took and passed that, and then that qualified me to become a diplomate in sports medicine, which is the highest certification that someone with a licensed chiropractor can actually attain in the United States. Just recently passed that examination, and so as of today, I'm one of 300 sports medicine specialists in the country trained to treat anybody who happened to be maybe unconscious on the sidelines or has concussion or has a fracture or basically has an emergency situation that I'm a first responder in prior to the ambulance showing up. So I was, going back to your question, very inspired by this ex-NFL football player who I've done quite a bit of work with and was able to help quite a bit. And he was giving back and donating his time to the school, so he motivated and inspired me to kind of better myself. And here I am, 25, 24 years post-school, going back to school, very intimidating when, you're older than the guy teaching you and double the age of most of the students in the class. But the first day of that class, the instructor told me something that I'll never forget. He said, if you're not uncomfortable, you're not challenging yourself. And I was very uncomfortable with the information. I've been out of school so long, Manny, that things like orthopedic testing of a knee has changed since I got my degree. There are tests, there are things they do now in sports medicine that they didn't do 25 years ago. So this is a great opportunity for me to refresh my skills and improve myself as a practitioner, not only for when I'm on the sidelines taking care of emergencies, but even in my office. I've acquired many new skills, diagnostic skills especially, when I'm working up a patient in the office. So I'm indebted to this patient of mine that kind of inspired me to kind of get out there.
That's awesome, and congratulations, by the way. That's a huge deal. I mean, you didn't have to go and do that. You got a great practice going. Like, why, rock the boat at this point? But I suppose if you've got kind of a hunger for, what's next and what's bigger and where more knowledge lies and all that, it takes some cojones to go do that. So right on for doing that.
For me, if I'm not learning, I feel like I'm kind of stagnant. And I think as a practitioner, and I'm sure you would agree with me, you're a rolfer, and I'm sure the techniques and the things that you do with your patients now have evolved. I mean, and they're going to continue to evolve. You're going to be a lot better at your craft 2 or 3 years from now than you are now. And
sure,
I think as practitioners, you and I need to continue to push ourselves for the benefit of the patient.
Yeah, absolutely. I totally agree. So getting back to athletes, you since you're focusing on athletes, and you have seen, for the last 25 years. I mean, if you're in even general practice chiropractic, you're going to be seeing athletes. But now as a specialist, we're focusing a little more on endurance athletes for this summit. What are some of the most common problems you see coming into your office from endurance athletes that can be prevented, do you think?
Well, let's take the three prongs of the triathlete. You know, you got the cycling aspect of it, you got the running aspect of it, and you got the swimming aspect of it. So in the swimming aspect of it, I deal with not only triathletes that swim, but swimmers and water polo players. You see a lot of shoulder problems, chronic shoulder problem. Basically, the swimming stroke is identical to throwing a baseball. So when you're looking at a swimming athlete, they tend to get impingement syndromes, they tend to get rotator cuff issues, very, very similar to what we see with baseball pitchers. So it's imperative that in the swimming aspect of being a triathlete, that the athlete pays great attention to posture, pays attention to the muscles on the posterior side of the body. In other words, the muscles that decelerate or slow that arm down, all the shoulder blade muscles, the lats, the muscles in the middle trap and the back, those muscles are often neglected and can lead to the shoulder basically migrating like superior, basically up and anterior or forward, and that leads to impingement type syndromes, rotator cuff problems. So those are very, very common. In the cyclist, for example, because that is so repetitive, especially in the Ironman distance, you see a lot of cervical spine injuries. You see a lot of what they call cyclist palsies as well, dealing with wrist issues in particular. So starting with the neck first, the position that someone's neck needs to get into when they're down on the drops is one of considerable extension. And in order to extend your cervical spine like that, you must have the ability to minimize the kyphosis or the curvature in the spine just below your neck, the thoracic spine. If you've got any roundness to that area, you're going to develop quite a bit of trouble at the base of your neck where your neck and your shoulders come together. So we see quite a bit of that. And then on the other side of the bike where the hands are resting on the handlebars, dealing with cyclist palsy, a lot of times you get compression syndromes in through the wrist as a result of hanging onto those bars. So those are some of the things we see in the cyclist. In the runner, boy, oh boy, you see a myriad of things there, from plantar fasciitis to shin splints, hip issues, and an interesting tidbit that I think our callers and people listening to this call will appreciate. When you're looking at a running type of injury, whether it's plantar fasciitis, whether it's shin splints, whether it's knee pain, it always goes back to the hip. Not 100% of the time, but generally greater than 95% of the time, the secret to solving those conditions, every one of them, including plantar fasciitis especially, deals with poor hip mechanics. So those are some things that we take a real close look at. And, of course, with a triathlete, you got to look at all of those things. So those athletes spend a lot of time in our offices.
I laugh because you named basically everything that I've gone through at some point. So, and I have to say, you know, as a swimmer, I've swam, you know, since I was a kid, and I'm recently getting coached, you know, for stroke, and
right.
It sure is humbling. It's like coming back, and I'm realizing some of these things, some of the way that I swim, actually a lot of it is the same way that I swam as a child, and that certain habits never changed. It just became more and more ingrained. So going back to school is a big deal, but it's actually really good because it frees you up to go on to greater heights. So.
And you're in the posture business, so if you improve your posture in the pool, you improve your posture on the bike and the run, you're really improving all aspects of your sport.
Sure, and absolutely. So aside from the typical musculoskeletal injury, what other kinds of things, health challenges in general, that you see are perhaps driven by the lifestyle of an endurance athlete?
That's an excellent question. Sidestepping all of the musculoskeletal stuff that you suggested there, I think the biggest thing that presents in my office that is kind of a sideline event, the athlete doesn't come to me with this, but it presents itself in front of me, and it's there as plain as the nose on the athlete's face. The athlete a lot of times isn't aware of it, but as you know, being an endurance athlete yourself, the type of training, the hours that go into it, the sacrifices you make with your family time, all of the time that you spend on the road, the bike, the ocean, everything else that you do, it's really, really tough on you mentally. And I find a lot of especially the ultra endurance distances, like the Ironman distance, ultra runners, athletes that run 100-mile races, I find that they suffer from sometimes mood disorders, personality disorders, maybe things that were possibly below the surface that get exacerbated or brought on by the type of training. There's been quite a bit of research in the last 5 to 10 years on endurance athletes and what it does to their brains. I think you'd find it really, really fascinating. It deals a lot with dopamine levels and other things that happen to the brain when it's pushed that hard. So I think, and you think you're going to see a lot of this moving forward. Golf is kind of already kind of gone there a little bit, even though golf is not an endurance sport. You know, golfers oftentimes have sports psychologists, right, because they want to be able to perform better mentally on the golf course. But when you're a triathlete, you don't really think too much about your mental game sometimes. And I think training schedules and nutrition and sleep patterns and things like that combined with the training can definitely affect you mentally. So I think mental health is probably, for a pro especially, the place that they're going to need to go to the most to get the maximum improvement. Secondly, the other thing that's also come up recently, mostly in the distance runners, has been cardiothoracic issues. Most pure runners don't really want to hear this, but there's been quite a bit of research done on the deleterious effects on cardiac muscle from long-term endurance running. They're seeing not only athletes' heart, where the actual muscles enlarge, but they're actually seeing cardiovascular disease show up in apparently very, very lean, healthy people. So it's quite troubling, and there's more research to be done. But initially, the initial research seems to indicate that chronic inflammation could be the enemy here, could be the culprit. So they're working more on that. So I would say right now, Manny, the two things that we're going to look at going forward will be heart and head. Heart and head.
So great. Now, are there are these things that you address in your clinic at all, or do those go out? What say somebody comes in with something like that? What would be a general recommendation to somebody?
Basically, when someone comes in, let's deal with the head stuff first. So we deal with head stuff in the clinic quite often. Let's just say we've got a gymnast, for example, that does fantastic in training, but they just don't do well in competition. That person probably needs a sports psychologist, so we make that referral. Someone that may be suffering from like a chemical imbalance or mood disorder or things like that, we've got referrals. So, you know, one of the things I see myself as, and one of the roles I see myself taking on in the office, is one of kind of being a quarterback, if you will, for the patient. So we're able to recognize these things. We certainly can't treat all of these things, but we've got a great source of referrals for that. There's folks in our community that are very high on the list as far as dealing with brain injuries. They're able to image the brain, do functional brain scans now to actually see what the brain's doing dynamically when it's thinking, as opposed to just static pictures like MRIs. So something called SPEC imaging has been used for that. So we've got a number of referrals for that. If it's a heart issue, of course, we refer them out to a cardiologist. So oftentimes patients come to me simply just for me to manage their case. And just to give you an example, a patient came into me complaining of a unique thing. He just said he has shoulder pain, but his arm was weak. And a guy who's 5% body fat, super lean, works out 6 days a week, for him to be weak was really disconcerting. And so we've done about, 4 or 5 different types of MRIs and scans and tests on him, and he's got a condition called suprascapular nerve palsy, which is a very rare thing, but it's nothing that I treat. But I've spent probably 4 or 5 sessions consulting with him, organizing his doctor referrals, setting up his MRI scans. That's another service that we provide at the office. So even though we don't treat it necessarily, we can certainly work it up and make the appropriate referral.
Yeah, and that's huge. I mean, it's for anybody who's been out there with a challenging problem to solve, and you see this too, I'm sure, Dr. Z, in your practice, but people will come in and they've been everywhere already and done everything, and they're just about ready to give up, and you're the last doorstep they're going to show up on. And so, but most of the time, it's all been random people with no coordination of care or consultation that kind of bounce from person to person. And So that's huge, because if you can go to one person like yourself, for example, and then do the consulting, get the expert referrals, and get the care that you need, that saves so much time, so much energy, money, and headaches. Because again, you're going to know this because you see these people. Sometimes their lives are on hold for years.
Absolutely.
And it's unconscionable that's going on out there. But yeah,
well,
I just want to make that point.
In the future, I think what you're going to see, Manny, too, is you're going to see a change in the way healthcare is delivered. Because right now, you and I are fee-for-service people, just like everybody else out there that works in medicine. They're all fee-for-service. There's a code that you bill, and it pays a certain fee, and that's the end of it. So if you're that patient, you're that triathlete that has, say, a leg injury, you might go to your orthopedist, you might go to a massage therapist, you might go to someone like me, you might go to you. There's 4 people right there. And
right.
So now the insurance company is going to pay 4 times for all of us to take a history on the same patient. Right. Very costly. It's not very efficient. The patient's running all over town. So the healthcare of the future, the patient's going to be assigned a team. All 4 of the people I just mentioned will all be on the team. The patient will get assigned that team, and the insurance company will pay the team one global fee to take care of that patient. And we'll figure out how to split the fee amongst ourselves. But that way, the patient isn't running around. The insurance company has to pay for a consultation once, and everybody wins.
Yeah, absolutely. Efficiency there is huge. So maybe you can talk a little bit about some of the challenges that you've helped patients overcome that folks out there typically may not be aware of, that are resolvable naturally and without, say, surgery or overly invasive intervention. What are some of those things that you do on a regular basis?
I would say tops on that list is disc herniations in the cervical and lumbar spine. If you ask the average person on the street and stick a microphone in someone's face at a bar, and you went and asked 100 people and you said, okay, you've got a herniated disc, who are you going to go to for that? People are going to say a surgeon almost every time. They're not going to say a physical therapist. They're not going to say a chiropractor. They might say those things, but they're probably going to say, more often, they're going to say a surgeon. What the public needs to realize, and especially those athletes out there, is they need to realize that there are many alternatives to surgery to treat spinal disc injuries, and they're very successful if you're the right patient. Now, not everybody chooses that avenue. For example, Peyton Manning. Peyton Manning's had, I think, 4 neck surgeries now, but he wants to play NFL football. He wants to be able to take collisions with giant people. Some of the conservative options aren't available to him if he wants to play those kind of collision sports. Tiger Woods just had back surgery. He had a microdiscectomy. He probably didn't want to take the time, knowing him, to try conservative measures. He wanted a quicker, more direct result. He probably isn't as concerned long term, just like Peyton Manning, more concerned short term. So for the athlete that's looking for treatment that's conservative, non-surgical, that takes care of disc injury, there's something called non-surgical spinal decompression, which basically is a fancy way of saying directed spinal distraction and disc treatment to the injuries specifically involved. So, for example, if you've got a 4 or 5 millimeter herniated disc, it's not shrouded in bone spurs, relatively healthy area except for the disc bulge, this type of treatment in a matter of a few months can not only eliminate the problem but prevent you from having surgery, not just now, but in the future, because it's a permanent solution if the rehab is done with it correctly.
Yeah, and that's huge. I can attest to that, having had a disc bulge in my neck and getting the decompression. And I got to say, since then, that was a great experience for me, because first of all, feeling what it feels like to have something like that go on, and the fear that comes through you, and realizing like it's going to affect everything. There's no way out of it unless you get the right help. And then, so when I see people in my office like that, because they come in, I have options for them. It's not, and an option with a powerful story about how it works. And if they're athletes, I can directly identify. So I can't say that enough about spinal decompression. But you say it's got to be specific. What about people who say have had an injury for a while, and maybe it's undiagnosed, and then they come in. Is that something that they could use as well, or they have to? Are there other
Absolutely.
challenges?
I mean, that's oftentimes what happens is people come in and say, "Hey, my leg's numb," or "Hey, my arm's weak," or "Hey, I've got this or I've got that." The key is, just like I'm sure you're aware, you need to make a diagnosis before you start treating somebody. So when people come in, when we make a diagnosis and the diagnosis is a herniated disc, that is definitely something that's going to be considered as a treatment option because nobody wants surgery first. I mean, we're not opposed to surgery at all. I've made quite a few surgical referrals over the years for the patients that need it. I had a patient come in that wanted to decompress his spine, but he had a 25-millimeter herniated disc. He wasn't going to get better with non-surgical means. He was a truck driver. He wanted to go back to driving his truck, and sure enough, he had his surgery, and to this day, it's been 5 years. He's still driving his truck. He's doing great. So the treatment has to match the diagnosis and has to match the patient. The patients that are not candidates for something like this would be somebody who has such a long-standing problem that the disc bulge has now been shrouded in bone spurs, and now bone spurs are actually what's causing the nerve compression, not the disc anymore. So if that's the case, a surgical referral is usually necessary when we've got some amazing surgeons that we refer to, both in LA and Orange County and actually outside the state as well. I've actually had one patient we referred to Germany for some procedures. So the key, like I've said many times in this call, is you've got to make an accurate diagnosis, give the patient options, and then go from there.
Wow. So that's thanks for clearing that up, because I think that's huge. Again, most people don't know that that's available to them. So, this is a shout out to the folks out there. Don't wait. If you got something going on, don't wait. Get in, have it looked at by a professional right away, because if you wait too long, then you may be looking at a more, invasive intervention that may actually take you off the out of training for longer or out of your season completely.
Exactly.
So, okay, great. So, wow, I mean, we could probably talk for, days and hours and all that. There's so much to share and so many cool things that you do, and hopefully we can bring you back sometime to ask more questions. But what is, for the folks out there, what's the best way? Say they wanted, if they're local, they can take advantage of you by coming to your office, but what about the people who are, say, not local? They're in, other states or other localities outside of Costa Mesa and Orange County area? How can they take advantage of your expertise?
Absolutely. For those folks that do have the means to travel, we are conveniently located right by John Wayne Airport. We're basically 5 minutes from the airport. We do have patients that fly in from different states like Texas and Utah and Seattle and places like that. But for those of you that especially don't know us and aren't willing to get on an airplane and maybe quite frankly can't, I'm available many ways. I'm available for consultation on Skype or whatever software that you're using that we can converse on. I oftentimes do consultations that way to, like we said earlier, just kind of quarterback the case, get the patient moving in the right direction. Oftentimes, if I've got a partner there on site with the patient that can understand and do some take some instruction, I'm able to actually orthopedically test people over the internet, because once I have them put in the proper position, I can kind of make some clinical decisions as to what's actually going on or what's wrong with these people, and then help them determine whether they just need physical therapy or an orthopedic consult, or whether they should find a sports medicine chiropractor like myself. You mentioned earlier that I had, and I also kind of went on a little bit about my sports medicine qualifications. There's a board called the American Chiropractic Board of Sports Medicine. So if anyone's looking for another person like myself in another part of the country, I'm going to refer you to that website. So it's the American Chiropractic Board of Sports Medicine. If you just Google that, the website will come up, and there's a list of practitioners there all over the country that have both certifications, both the CCSP and the Sports Medicine Diplomate, and those folks are uniquely qualified to take care of your athletes, Manny. So that would be my first choice, and in fact, that's what I do for patients that aren't in my area. I refer them to that website. And then, of course, I'm available by email. They can email me at Dr. Z, which is DOKTRZ at southwesthealth, all spelled out, .us, and I'm happy to get that back to them by email as well.
Awesome. And so quick question on that. Do the other diplomats, are they also quarterbacks like you, or is that something unique to your practice?
That's a great question. I think it's something that is unique to what I do. Not to say that no one else out there is doing that, because they all have the training to do that. Just like any other specialty, Manny, if you look at the other people that practice like you might take a different approach than they do, even though they've got the same training as you, so I can't speak for them. But like I said, that's a great place to start. I always ask the patient or encourage them to interview these docs. So just because they're on there doesn't mean they got a great personality and they're willing to help everybody. But I always say that's a place to start, and then start asking questions and interviewing too. And then I'd say one last thing. If you're looking to get to my website, that is www.swhprofessionalcenter.com.
Great, yeah, and we'll have the links in the show notes as well. But once again, I want to thank you. I brought you on here for a very specific purpose, because you do something special, and I don't know anybody else who does anything close to what you do or has a center anywhere near what you have. So I wanted to share that with folks, because I think that a lot of people are just not aware of what the resources are and all that. So thank you so much for sharing with us today.
My pleasure. Thanks for having me on. Hopefully we've got a few more athletes out there and patients that got some information they can run with.
Yeah, absolutely. No, absolutely. So that's our whole purpose. So again, so folks out there, thanks for joining us today. I'm going to go ahead and, like I said, post those links to Southwest Health Professional Center, Dr. Z's email, phone number, and all that. I'll post those in the show notes for you. So they're there. You can click over and make the contact so you can get some quality quarterbacking. And other than that, this is Manny Aragon signing out, and thanking you very much for listening to today's installment of the 2014 Endurance Summit.